Hi everyone, Dr. Marco here. The health tip this week, we're going to be talking about an alternative or a different way of looking at a very painful condition that's called plantar fasciitis. So it's an extremely painful pain right on the bottom of the heel or in the arch of the foot. Very often the first few steps in the morning when you get out of bed, it's like somebody's sticking a knife in there. Traditional therapy will almost always try to treat the heel somehow or treat the fascia. So people will be rubbing their foot over something, or they'll be using ultrasound or trying to do some sound therapies, whatever it is, to try to get the inflammation of the heel down. But continuing in my series of doing the opposite, or working on the opposite side or opposite part of the body, just as an example, there's a very painful condition that we used to call reflex sympathetic dystrophy. If somebody like maybe had dropped something heavy on their foot and it caused some nerve damage, that person would have an intractable pain in that part of their body, and trying to treat it all the time would actually make it worse. So what some of the functional neurologists actually found is if you put like an electrical stimulation on the opposite side of the same part of the body wherever the damage is, stimulating the opposite side where they're not hurting actually made that part get better. So sometimes working on the opposite side of the body or the opposite side of the part that's painful can actually be the key to the resolution. So I've had a number of people that have had this. Very often just doing network care and making the nervous system healthier will decrease tension in the heels, because that's one of the things we look for. We're actually looking at the tension in the heels. We want the tension to come out of the spinal cord as people do our care. But if somebody has like a really chronic, bad, long-standing thing that they've had everything done to the heel or the calves and all that kind of stuff or the arch, there's another way we can work on it. And I'll just show you that the way I kind of look at it, or way you can work on it yourselves at home to see if that maybe gets you over the hump or gives you a different solution to a problem that can sometimes be very, very dramatic and pretty chronic and cause a lot of discomfort to a lot of people, difficulty walking and all sorts of other things. So let's go to the video and I'll show you that, and we'll see you next time. The person might be experiencing a lot of heel pain under the heel or into the arch. We're actually going to be focusing on the opposite side. So sometimes we might actually do the opposite heel for neurological consequence, as I mentioned before, or we're just going to go to the opposite side of the body. So what happens is there's a lot of muscles here that come and attach onto the front, and if they're tight or they're out of their normal tone or tension, they could be pulling here and actually causing the opposite side to be working harder and cause it to be inflamed. So we've had people for years having plantar fasciitis, having it rubbed on, rolled, hit with ultrasound, all sorts of things, and if it doesn't resolve for some reason, you might want to look at working on the opposite side. So what you can do yourself, you can just take your thumbs or just work on the outside of these. These are the muscles that come down and attach into here. So you can just take your thumb and slowly work along it, and if you find a tight spot, just hold it, push in, hold it for a little bit, and keep going along there. If you have one of these little instruments that you can get at wherever you find them at different stores, like Winners or whatever, so these kind of little massaging things here, you could use that too, and just kind of work it like this. Find a spot that's kind of tight, push in and hold it for a little bit. Especially you might want to work around the front of the ankle here too, so you'd actually be pushing in here. I would actually be using these smaller ones if you have it, or just with your thumb, or you get somebody else to do it, but just put some very firm pressure, hold it for like 15, 20, 30 seconds until you feel it kind of release a little bit. Move it around, and you can work in through here along the front like this. One of my patients actually did have plantar fasciitis, and he's had it for like a long time, and of course he's had all the work on the back. I told him I was going to do the opposite side, and of course he looked at me like I had 3 eyes, but then after the first session he said the pain had decreased already about 40% the next time I had seen him. So it's just something else you can look at, some other way to consider to working on the opposite side of the body, and that's a very common theme that I'll be going through in other videos as well. So that's your health tip for this week. If this is helpful, please share it on YouTube and with your friends on Facebook, and we'll see you next week.